Welcome to Franklin County Home Health Agency's Where the Heart Is. I'm your host, Courtney Bates. Franklin County Home Health Agency offers a full range of quality home health care, hospice, and support services for people of all ages. Through this monthly show, we bring you information about the agency's programs and services, as well as tips to help keep you and your loved ones safe and healthy at home. This year, Franklin County Home Health is introducing a new program called Care and Comfort at Home. Franklin County Home Health was among several eligible hospices nationwide invited to participate in a Medicare Care Choices model derived from the Centers for Medicare and Medicaid Services. Here today we have Jean Doobie, Sue Williams, and Emily Burns of Franklin County Home Health to tell us more about this program and the services we can provide through Care and Comfort at Home. Thank you for being here today, ladies. What is Care and Comfort at Home?
So Care and Comfort at Home is a program that is geared towards palliative care type patients. It's a program that will help meet people that have been given a life-ending prognosis, and they have a time frame that they're working with, but they really don't want to sign into hospice yet. They want to have the flexibility to seek treatment, to go to the emergency room, to follow up. If they're in treatment, they want to continue those things, and this lets them have the best of both worlds. They can pursue their treatment, have support of nurses and volunteers and such at home, while working with the diagnosis and prognosis that they've been given.
It offers also a nurse management, case management, so we can really work on symptom management if there is an issue, and it gives a broader spectrum.
Great. I think it adds, like Jean is saying, like more people to their care team, so they have a lot more focused care and a lot more one-on-one attention. So because we all know everybody's different as they go through life, so this is one-on-one management of the process that they're going through.
It's a lot of extra support too.
Yes.
How does Care and Comfort at Home differ from hospice?
So Care and Comfort at Home allows the person to pursue treatment. So if they still want to go to the hospital or still want to receive chemo or radiation and see their physicians, that's possible. Where in hospice, the philosophy is that you don't want to seek treatment anymore and you want to stay home. We do keep the doctor, of course, in their care team, but they're not out pursuing treatment. So those are the differences.
So who is eligible to receive Care and Comfort at Home?
So anyone who fits the criteria for hospice. So they've been given a prognosis of 6 months or less in an end-stage disease in one of four. So cancer, COPD, CHF, HIV, and AIDS. They can pursue whatever treatment they'd like, and the doctor just needs to sign that they do have the prognosis.
So
I forgot one other thing. They also have to have Medicare, the Medicare benefit for the last 12 months, A and B, and they would have had to have a hospitalization in the last year and have seen their doctor 3 times in the last year.
So what is that referral process like? How can you refer someone to Care and Comfort at Home?
So the paperwork would be sent from the person's doctor, and hopefully the doctor has explained this is what we're looking at for a prognosis for you. And they send the paperwork to us, and then we will sit with the patient and their family and discuss really what are your goals. Are your goals to be able to go to the emergency room if you need to, or to continue to have doctor's appointments working within the time frame that you've been given? Or is your plan just to stay home and have your symptoms managed, and then that would be more of a hospice philosophy as opposed to a Care and Comfort at Home?
So can anyone make referrals, or does it have to be the patient's doctor, or can the patient make their own referral? Or
I would think that
or a family
anyone
member?
or the family or patient, we definitely communicate with the doctor. So we would get the information, and if it wasn't the doctor's referral, we would follow up with their primary physician, letting them know what the patient's goals are and how we can best serve them.
So you work closely with their care provider, their other care providers. How does that work? How do you communicate with them?
Either, telephone, just keeping them updated on what's going on with the patient, any changes. That's basically, the best way is just to call and let them know.
There's a lot of collaboration that goes on, and the patients would also, I hope I'm not jumping ahead, would also be discussed in our interdisciplinary team. So they would have the team approach of the social work, the volunteer, the bereavement, the spiritual. So they receive all of those benefits as well.
That was a nice segue to my next question. How does the Franklin County Home Health team work together?
So as Sue mentioned, we have an interdisciplinary team. We meet every 2 weeks. There's a physician, nursing, volunteer, bereavement, chaplain services, and social work services in this meeting, and we talk about everything to do with every patient's plan of care for symptom management, any spiritual needs, volunteer, LNA, anything like that. So that patient would be part of that meeting every 2 weeks, along with our hospice patients.
Emily, what kind of support does a social worker provide in Care and Comfort at Home?
So it's a lot of helping people with resources. So if there are different community resources that they haven't been connected with, I can definitely help with that process. Different documents like advanced directives when people are looking to have that conversation about what their end-of-life wishes might be. I can go and help people with those pieces of things, and then emotional support. So whether it's on the phone visits, just being there to support people as they're making these big decisions in their life, the family, the patient, whoever really could benefit from having someone to talk to.
And you mentioned volunteers as well. How do they play in?
So just like our hospice patients, the volunteers would go out and spend time with the patients or their families, giving their family time or respite, for a break. They can also, if the patient is stable enough, take the patient out for an outing, again, to give respite to other family members. But they are trained to go into our hospice homes, and the program falls in the same category.
Why is Care and Comfort at Home, why are these services valuable to the people of Franklin County? Do you think there's a strong need for it in this area?
Mm-hmm. I think there's a big opportunity, more for education about hospice and end-of-life care and goals. So using the Care and Comfort as a segue either to hospice or just a regular home care allows us to go in and provide really good education to the patients and their families here in the community.
And it's going to be the same team for the most part as hospices, so it's a good opportunity for us to build those relationships, because when it comes down to it, that's what a lot of hospice is, and just being able to have someone know who's going to be coming in, especially as things are progressing, so that they have that comfort level.
And I've recently had a family member say that they were so thankful that they cared for their loved one at home, and they would encourage anyone to do the same. So if using this program to bridge, to get them comfortable and understand what services there are, help them with the adjustment, then that's another great thing that we can offer.
Yeah. So Franklin County Home Health was one of several eligible hospices nationwide selected to participate in this program. Are there any other home health agencies in the state that offers this, or are we the only one?
Currently, there's one in southern Vermont. I don't know how they're doing with it. And I think they were part of the first cohort. We're in the second cohort. So.
And this program will be available for 2 years
Yes.
from now. So
Yes.
started January 1st through January 1st of 2 years from now.
So explain that. What do you mean when you say?
So Medicare is doing, they're doing different things with their billing and really trying to help people get the best possible care and to be satisfied with their care. So this is a trial, or it's a test run on a different program. So right now it's set up for 2 years to see if it really does help people meet their needs at home and if there is a need for this type of bridge program.
Actually been going on for 2 years. So the CMS broke it up into 2 cohorts. The first cohort has been in play for the last 2+ years. And in those 2+ years, they started collecting data on symptom management services used, length of time in the program, and the length of time bridging either to hospice or if they didn't do it at all. So we're in the second cohort. The plan is, I think, 2 years, as Sue had mentioned, but the CMS at this point, I don't think they have a plan to what's going to happen after the 2 years, if they're going to extend the cohort or if this will actually become a Medicare program.
So you had mentioned that other home health agencies nationwide have been participating. Have they been successful?
Yes. When we went to Baltimore and spent some time with the CMS to learn about the program and had the opportunity to hear from other cohorts, they have had really good results. Patients in their communities with end-of-life diseases, the 4 that I explained earlier, are really getting a lot of support from the service.
So let's say one of our viewers is interested in learning more about care and comfort at home for themselves or for a family member. What should they do next? What are the next steps?
They can call us. They can call the agency. They can reach out to any of us. The intake team is aware of the program, so there's lots of ways. Just give us a call and we'll work it out.
Can they talk to their doctor about it too?
Sure. Yep. And their family or...
Yep.
Great. Well, thank you for being here today, ladies. Well, that's all the time we have for today. I want to thank our guests, Jean, Sue, and Emily, for coming on our show today and telling us more about the new Care and Comfort at Home program offered at Franklin County Home Health. For more information about Care and Comfort at Home and other care and services Franklin County Home Health Agency provides, visit our website at www.fchha.org or call our office at 802-527-7531. Thank you for watching.